We're here at the 2016 CROI, and we're here with Bruce Brew, who's from St. Vincent's Hospital in Sydney, Australia. We appreciate you taking the time. We've done other interviews with you over time, and I think this issue around neurologic issues and HIV are very concerning and for many people, but there's a natural progression too. So how can we differentiate between the two issues, the norm and the HIV?
Well, it can be very difficult, but there are a number of tools that can be used in addition to clinical assessment. But the tools, I don't think there's one answer. It's a combination of astute clinical review in combination with appropriate imaging, blood tests, and in selected patients, lumbar puncture can give information that is helpful to management. Yeah.
So we've been talking about this conference not having a lot or almost anything in mental health, but neurologic issues can lead to mental health and as well many other things. So it's kind of multifactorial. But how do you see this this playing out? Because we have people are now expected to live a long time. In the old days, people didn't care what they didn't care what they did to their bodies, but now we have to maintain we want to be living healthy and we want to thrive, not just survive.
I think the issue of mental health is absolutely critical, and it is disappointing that there's not enough representation at the conference. To be fair, it's judged by what people submit as to what gets presented. But there's no question that neurological disease overlaps very heavily with mental health. And by and large, there's a bidirectional interplay between neurologic disease and mental health, to the extent that neurologic disease can certainly lead to mental health issues and vice versa. And the treatment of one often impacts in a beneficial way on the other.
So is there, there is a lot of, like you said, it depends upon the science. If there's no one submitting or they don't submit, whatever they submit gets either presented or maybe rejected. But the one thing I'm concerned about is how do we tell our population at this point what to do, or maybe how to first of all understand what it is they're dealing with, that they would then go to the doctor or be referred to someone for either mental health issues or for neurologic dysfunction of some sort.
So I think, I was talking about this with some other colleagues last night. I think the most beneficial thing to consider not on a population basis, I'll get to that in a second, but more on a community basis, is to grapple with the problem in a scientific way and to encourage scientific research into the issue. Because at the Delaney lecture, I asked Laurel Sprague the issue of stigma and cognitive impairment, both inside the community and outside the community. And I think it spoke volumes when she said that she'd been living with HIV for 20 plus years and she found it too scary. And I really think the time has well and truly come for all of us to grapple with this and come to some sort of factual basis upon which we can move forward. There's a profound misconception that HIV will affect the brain in everyone.
Regardless of whether HIV positive or not, or just more so with HIV.
More so with HIV, and that it's an inevitable consequence as patients with HIV live longer. And that's not necessarily true at all. So I think that message needs to get out very loud and clear. And then there is a misperception that I think that you can't do much. Once you've been diagnosed with surety, then that's a sort of a sentence, and that's not true either. There are things that can be done, and people are actively working on ways to even improve what can be done. But there are certainly things that can be done.
Has there been any research at this conference that you feel was worthy of note that you can mention regarding neurocognitive dysfunction or
It's really been very small steps, and those steps have been confirmatory of what we know. But also some steps that are very cautionary. So I think there's further information to state that the brain can be involved early on, not in everyone, but can be. And second, that diagnosis can be very difficult because now there are a multitude of factors that impact upon brain function. Not just HIV, but aging, as we mentioned, and a number of vascular diseases now becoming much more of an issue. So I think that was those factors are important, and then segueing into vascular disease and stroke, I think that is perhaps one of the aspects of the conference that is worth mentioning and requires much further work. Certainly the theme discussion highlighted the fact that it is a growing issue. It's not unexpected that it is something that should be an issue, and it's not unexpected that it should be something that's coming after recognition of myocardial infarction, because that's the natural history of atherosclerotic vascular disease, which I think is at least the most concerning aspect of stroke in relation to HIV. And whether it demands a different approach to management, I think is something that needs to be addressed. Whether patients who have risk factors demand earlier intervention or a different sort of intervention, I think are issues that I think have been placed on the table and now need to be addressed.
Mm-hmm. So 30 or 40 years on treatment or living with even longer with HIV. In some cases, people have been untreated for many years and only recently been required to be treated, or not required, but requested in many cases. But if that's the case, it is likely that we're going to see everyone dealing with a little more of a problem as they move on down the line, as we live longer. And it's so we had this program on this panel on accelerated or accentuated aging. So this is just yet one more piece of it that seems to be more profound in the case of HIV, whether it be cardiovascular or neurologic.
Yes.
So do you feel that there is I guess the drugs usually are determined whether they cross the blood-brain barrier, which might be helpful.
So that's a very complex issue. Mm-hmm. And I don't think I think the one of the most fundamental aspects of the pathogenesis of brain disease is whether and to what extent in an individual patient the disease is driven by what happens in the periphery versus what happens in the brain. Mm-hmm. And I don't think we have the tools yet that are really precise enough to define that.
That was going to be my question, yeah.
Right. Yeah. And I think the whole field is muddied by the lack of appreciation of that as a concept. Because if you do trials with new drugs or comparing old drugs and trying to say it doesn't really matter whether a drug gets into the brain or not, well, if the cohort that you're studying has peripherally driven disease, then sure, it's not going to make any difference. Mm-hmm. Conversely, if some of those patients, or the majority, have brain-driven disease, it will make a difference. And I think that really needs to be articulated in a better sense. We need better tools. The CPE scoring system, has been talked about a lot, and it's a good tool. It's not the only tool, and it's not the end of the story. I think there is emerging evidence that the antiretroviral drugs are very good, but they don't work at a particular part of the viral life cycle. That means that certain viral proteins can still be produced. And I think there's an increasing awareness that that's important. Mm-hmm.
So you're saying maybe the ones that work early on as far as like not maturation inhibitors or,
pre-integration,
Yeah.
integration and pre-integration are probably good, and the ones that work after, maybe not so good. I mean, are good in terms of not producing whole virus,
Right.
but they still may allow the production of small bits of viral protein that may not be so good.
So, in theory, and you're suggesting that this may be important to have the diverse regimen.
I think so, yes. Not only a diverse regimen, but I think it should serve as an impetus to validate that as a possibility that these viral proteins are still produced and significant.
This would all be a part of having the right tools and the right markers. And
correct,
stuff. Yeah.
correct. And also I think serves as a stimulus for the development of new drugs that can actually stop those viral proteins.
Well, you've kind of introduced something here. You've kind of dropped a bomb. Maybe we need to plant it and plant that seed somewhere. And well, our audience, maybe they'll take it up and run with it. I don't know, but
I hope so.
And of course, you're none the least of which should be going after it too. Right?
We're trying.
Well, thank you very much, Bruce. I appreciate you taking the time with me.
Pleasure.
Thank you.
Thank you.